your 20s, what do you need to think about when it comes to fertility?
I think the two most important things are whether you have a normal period or not. If you don't have a normal period, you might not be releasing your eggs, so you might not be ovulating. And the other big thing is to really avoid sexually transmitted diseases, chlamydia, gonorrhea, all the things that you can be exposed to if you're sexually active.
And do they affect fertility?
They can affect fertility because they can block your fallopian tubes.
So that's something important. And in your 20s, should you talk about freezing your eggs? We heard about your eggs are kind of at optimal capacity from your mid to late 20s. So is that something that women who don't have a partner or no partner in sight should be discussing?
I think it depends on your sort of life, your life path. If you see yourself having big blocks of time taken away, for instance, going to medical school was 4 years and doing residency is 3 years. If you see 5 and 6 and 7 years coming beyond 28, I think freezing in the end of the 20s is not a bad idea.
What about when you hit 30? What are some of the things you need to know then?
So in the 30s, it's the same as the 20s. You still need to worry about whether you're having ovulation, whether you're having regular periods, and the sexually transmitted disease issue. But like we heard today, the whole ovarian reserve issue needs to be addressed. So I think it's a good idea to ask your gynecologist to do ovarian reserve testing, which is hormone testing. It's a simple blood test just to see, are your ovaries acting the age that you think you are?
When you're in your 40s and you've yet to have a child, what are some of the things you need to know then?
Well, my personal feeling after being a doctor for 23 years is that any baby born to a woman over the age of 38 is a gift. Our reproductive prime is 16 to 28, and in fact, most women are waiting almost a decade after their reproductive prime. Many women, not most, but many women are waiting beyond their reproductive prime to have their children. And so I think seeing a fertility specialist very quickly, doing anything you can to get pregnant if you're in your 40s. Quite honestly, at the age of 45, almost all women are sterile. So you have to divide the 40s in half. You really only have fertility potential in the first half of your 40s.